Hello, and welcome to Hadassah On Call, New Frontiers in Medicine. I'm your host, Mayan Hoffman. May is Mental Health Awareness Month, a month meant to raise awareness of trauma and the impact it can have on the physical, emotional, and mental well-being of children, families, and communities. Before October 7th, mental health issues were already prevalent in Israel, with around 25% of the population estimated to experience some form of mental health disorder during their lifetime, according to data from the Israeli Ministry of Health. Since the Hamas massacre and the ongoing Gaza war, the situation has become worse. A study published in The Lancet in January found a broad and significant impact of the October 7th attack on the mental health of the Israeli population. It underscored the need to provide rapid, nationwide assessments and triage for interventions to address the mental health needs of Israel's citizens. A separate study by the Israeli Pediatric Association reported that 83% of Israeli children are suffering from emotional distress since the attack. Everyone knows someone who has been harmed by or since October 7th. My children have classmates who have lost siblings fighting in Gaza. They say psalms in their schools for the hostages and have learned their names. And being from Jerusalem, we are very familiar with American-Israeli hostage Hirsch Goldberg, whose uncle prays at our synagogue. As a journalist, I have spent days in the South and meeting with the people impacted by the massacre and the war. At the beginning of April, on the 6-month anniversary of the attack, I spent 2 days traveling to 12 communities to learn where people were holding. While there is undoubtedly resilience, many survivors are still stuck on that day. To talk about Israel's trauma and mental health in general, we have with us today Dr. Shiri Ben-David, the chief psychologist at Hadassah Medical Center. She started her career as a rehabilitation psychologist at Hadassah in 2004. She completed her doctoral studies at Bar-Ilan University in 2008 and is also a senior lecturer in the psychology department at the Hebrew University of Jerusalem. Welcome, Dr. Ben-David.
Thank you. Thank you for having me.
For sure. So we're going to jump into something that I think is really challenging here in the state of Israel. Even before October 7th, the country was experiencing a tremendous amount of trauma. There are people that had been through many, many traumatic experiences because this isn't the first war, although this one is very different. Since October 7th, I understand that there are as many as 2 million Israelis who are suffering from some form of post-traumatic stress disorder. Can you verify that statistic? Is it correct? And also, what does that mean in terms of treatment and access in the country?
Well, I'm not sure that we have exact data regarding that. The best study that I know was published a month ago by the Hebrew University in collaboration with Columbia University, which estimates that about 500,000 Israelis will suffer post-traumatic stress disorder because of October 7th war. But that doesn't mean that other people do not suffer. They are just not corresponding the diagnosis of post-traumatic stress disorder, but still can suffer a lot of stress-related symptoms.
Interesting. And I'm sure that's added to whatever number existed before October 7th. So what does that mean for treatment when we start to think about the kinds of services these people need to receive? It's a very large number of people for probably not so many psychologists, therapists, etc.
Of course. And we know that as soon as we treat, as soon as we intervene, the consequences are better and the prognosis is better. So we have all the motivation to seek these people and approach them as soon as possible. And as you were saying, services lack even before October 7th, and of course, right now. So what are we doing? We are recruiting more psychologists to our services in the hospital, in the private practices. And we approach those people in the hospitals, even at the combat areas. We approach them and we look for first aid interventions. Our hope is that less people will need further interventions. We see it, for example, in the battlefield, that as soon as we intervene, even within the battlefield, less soldiers will need more interventions later on.
That's very interesting. Now, when we talk about the symptoms of trauma, What exactly are we talking about? What kinds of symptoms do people suffering from trauma experience?
So I would like to make a difference between a traumatic event and traumatic response.
Okay.
A traumatic event is something that we experience that is a threat to our lives or our self body and our relatives' selves. But most people who suffer a traumatic event will not suffer psychological responses. Actually, it is estimated that on average, 80%, 80% of people who suffer traumatic experience will not suffer post-traumatic stress reaction or disorder later on.
Meaning only 20% do.
Exactly.
Okay.
Meaning that we are actually have more strength and resilience than we actually think. But still 20% of people will suffer traumatic responses, and it is still a lot. And we do distinguish between the on the timeline of the traumatic event occurrence and later on responses. So in the first few days and weeks, many people would suffer stress reactions. We don't call it PTSD yet. We call it stress reaction, acute stress reaction or acute stress disorder. These are severely, heavily symptoms, but most of them disappear on their own, even without intervention, later on within few weeks.
Okay.
For those who suffer persistent symptoms a month or more after the traumatic event, then they are diagnosed with post-traumatic stress disorder. And this includes intrusion symptoms like nightmares, flashbacks, memories during daytime, avoidance symptoms, avoiding talking about the traumatic event, returning to the places where the event has happened, and so on. Arousal, startle responses, anger bursts, cognitive changes. This is what we call PTSD.
And if somebody doesn't have PTSD, as you mentioned, they might not fit the diagnosis of that particular issue. People could be suffering from symptoms that are not full blown PTSD, I'm assuming, but still have some kind of traumatic response that is ongoing. Is that correct? Or need some psychological help?
Exactly. There are certain specific symptoms that should occur to be diagnosed with PTSD, but of course, people can suffer various symptoms that would not correspond to the diagnosis. We can call it partial PTSD or stress responses, and still they're suffering major pain.
So, when you talk about PTSD and the 20% that do develop it, is there a certain criteria or kind of person that tends to be more prone, let's say, to suffering from PTSD or developing PTSD, or is it random?
There are risk factors,
Okay.
and risk factors can be dependent on the person that was before the traumatic experience and also on the characteristics of the traumatic experience itself. When we're saying 20%, it's very general, but we know that it differs in different traumatic experiences. For example, sexual assault or rape causes a higher percentage of PTSD than a car accident.
Okay.
They are both traumatic experiences, but the percentage of people who would suffer PTSD later on differ. And it also depends on the person. If the person had prior traumas, they're usually more prone to develop PTSD. If they had previous mental illnesses or other mental illnesses in their families, if they come from a lower socioeconomic status, lower education, if they are women, they are more prone to develop PTSD. If the trauma occurred at a younger age, people are more prone for developing PTSD. So there are different characteristics that make people at a higher risk.
Interesting. Now, what about children versus adults? Are children more likely to develop PTSD than adults, or vice versa? You mentioned the younger age factor. And with that, in general, not even PTSD, but trauma, longer term ramifications, is that more likely in children or in adults?
So yes, children are more prone to develop PTSD. And we think it may be related to the sense of helplessness that is related to being a child. Because we think that one of the characteristics that make people more prone to PTSD is the amount of controllability they had during the traumatic event. We know that people that are in charge of something or they have a role during the traumatic event, suffer less PTSD because they have something to do. They have a role. People rely on them. They have something they can do to make the trauma maybe less affect. So children, basically, they are helpless in these situations. So this is one of the reasons that they will think they are more prone to develop PTSD, and it very much depends on how the adults deal with them during the traumatic event, how much they feel protected, understood, how much people explain to them what is happening.
Interesting. So, what about people who lived through, let's say, an actual attack versus somebody who's just watched it? And I bring that up because here in the country, when we just had, Sheryl Sandberg's new documentary has just come out about the terrible sexual trauma and assaults and murders that happened on the 7th. We've had many, many clips shared by Hamas and cameras that really our whole country, most of our country has seen. What happens to those people versus the ones who are, God forbid, on the film? And with that, I think also knowing someone. For example, you weren't in near Oz that day, but you normally live there, and your neighbors were attacked, and now you have your whole community has been destroyed, but you didn't actually experience the trauma.
Well, statistics show that the closer you are and the more persistent the trauma is, the more you're prone to develop PTSD. So, of course, if you were there, the risk is higher than if you only heard about it or you could have been there, but you weren't there. But the closest you were or your relatives, the higher chances are to suffer.
And what about, again, not just PTSD, but just symptoms in general? For some of these, for a country that has sort of watched all this trauma, is there something that we should be cognizant of or doing to help those people?
I think we should be ready for millions of people suffering certain psychological distress. So it may not be PTSD, as you're saying, but other stress reaction, depression, anxiety disorders, eating disorders, substance abuse disorders, which we already see that are in higher percentages. Yes, wow. Exactly. So we should be ready for various psychological symptoms that would affect millions of people in the country because, as you said, every person in the country suffered some kind of trauma, either by being there, hearing personal stories, watching on TV, should run to the shelter because of alarms. I don't think there is one citizen in the country that didn't suffer any trauma during this war.
What about a soldier that is fighting in Gaza or, God forbid, the hostages that are there? What kind of psychological impact are we expecting on these, poor citizens who are fighting for now, some of them 6 months, or we don't even know what's going on with the cohort that is being kept by Hamas?
Well, regarding the hostages, I would humbly say that I don't know. We don't have any clinical data of people being held by a terror organization as hostages for so long. The people who came back are psychologically treated, and I will not relate to them specifically because there are few and they are known. Um, but I would relate to the soldiers that we know that many of them suffer acute stress reaction and they are treated within the battlefield. Most of them are able to go back and to go back to the battlefield, as some of them don't. Some of them have to stay at the back or even be released. As I said previously, being able to fight, to have a role, to have a weapon, to have a mission is highly protective of post-traumatic stress reactions and symptoms. So this is very different between soldiers and hostages or people who were held in their shelters at the OTF during 7th and 8th of October in the terms of having a mission and being able to do something to protect yourself.
Yeah, that makes sense. Do we have any knowledge about the family members yet who have lost? We have all these displaced people as well who were taken out of their homes. Some percentage have started to go back, but many continue 6+ months, over 200 days later, to be displaced, certainly in the north as well. let's talk about them. I mean, what happens to somebody who maybe, I mean, the North, I think, is a great example because the people in the North, there was rockets, they're used to rockets, but not as much as the South, but there's been rockets. But now they've been 6 months out of their homes, and it just keeps going, and there's no end in sight. So, what do we do with these people? How do they make it through?
This is also a traumatic experience. Having your house being your home, being so unprotected. Home is where we feel safe. I think that is one of the psychological definitions of home. And in this case, home is not protected, home is in danger. And these people don't have their routines, they don't have their social support that they used to have, they don't have their communities. Most of them are spread away. Five people living in a hotel room. This is not a vacation. All the roles in the family are changed, are being displaced. Parents cannot make dinner to their children because they go to the dining room at the hotel. Their laundry is not made by them; it's made by the hotel services. It makes the whole family structure change in a way that is uncontrolled. This is a major stressor, and not knowing what is going on, being uncertain about the future, is a major risk for these people's psychological health.
So, what kind of tools are we working on in the country? What are we doing to improve the services that we offer?
So, social services and psychological services are spread around the country. The first 1 2 months, it was a huge mess, like the whole country was a mess. But little by little, we get organized and we do send our services out to the hotels, to the rest of the country, to the communities. At Hadassah, our psychological services were sent from October 10th to the hotels around Jerusalem, to the persons who were displaced in these hotels. And we're just going there day by day, sitting on the grass and waiting for people to come and talk to us. So we're doing the best we can to spread our services and to recruit more and more professionals, because being treated by trauma professional is crucial for mental recovery.
And are those programs still ongoing with Hadassah today?
Yes, of course. Now we don't go to the hotels anymore because as the time went by, we thought that the best approach would be to adopt a routine, a certain kind of routine, even when being displaced. So, as a routine, you come to see our psychologists at the services. So, we do see them here at our ambulatory services, at our clinics, and we do provide an ongoing psychological health to the persons who are displaced, to soldiers who arrive here injured almost every day, to our soldiers that are hospitalized at a rehabilitation hospital, and to whoever approaches Hadassah to seek for mental health, either by the ER or by just approaching our clinics and seek for mental.
Now, is there any new research that is being done, in the aftermath of this attacks that will have data in case, God forbid, there would ever be another need for it?
Well, it is very important to do that. To be honest, I wasn't busy at all in research during this month. We were asked to collect data, and we only start to collect that because we were very much concentrated in providing psychological help, and collecting data seemed even inappropriate during these times. But as you're saying, it is very important, and we start collecting that.
Makes sense. We're doing this episode now because May is Mental Health Awareness Month. And I'm wondering if you can talk outside of October 7th and outside of even Israel about mental health more in general and some of the misconceptions that people have about mental health in general, and how can we work to dispel them once we know what they are?
I think there are many misconceptions, though not as many as has been maybe 1 or 2 generations ago. So I think we're doing quite a good job in integrating people with mental disorders in our society, in our Western societies, I would say. One of the misconception is that having a mental disorders makes you more dangerous to other people. which is totally not supported by research data. But people are still afraid to have, for example, a mental health shelter in their neighborhood, on their streets. They don't want their children to meet people with mental illnesses because they may be dangerous to them or even just weird. But we do know that people with various mental illnesses are highly integrated in the communities. They're actually around us everywhere. They don't go with a sign on their forehead, so we don't know that, but they're actually everywhere integrated in work, in community services, volunteering. And actually, people with mental disorders are able to live a meaningful life, being part of the community, support and being supported, having family life, romantic relationships, being good parents to their children, and being a full part of our healthy society.
Are there effective ways that individuals can support people with mental health disorders? What are the best ways for us as a community to integrate them and to support them?
Well, social support is one of the major protective factors against mental deterioration in all kinds of mental disorders. So, being supportive is one of the best things that we can do if we want people with mental disabilities to be part of the community. How to do that? Basically, treat people as normal. We all suffer from various disorders, even if not diagnosed. Nobody is perfectly mentally healthy. So just treat every person with respect. Ask them if they need help, but do not provide help if not asked for. And see how people, what kind of relationships people would want from you, and provide those kinds of relationships.
Are there certain mental health disorders that are more common in Israel than others? And if so, what are those?
Our statistics is quite similar to the rest of the Western world, even in PTSD.
Okay,
which
wow,
is
that's
which
interesting.
yes, maybe is not so intuitive, and maybe not after October 7th, but generally. Mental disorders are more common when we speak about mood disorders, depression, postpartum depression, anxiety disorders, social anxiety, phobias, and so on, general anxiety disorders, and less common, such as schizophrenia or bipolar disorders, which are less common worldwide.
But still prevalent, I guess.
Yes.
And is there any difference in the geography in Israel, like, Jerusalem versus Tel Aviv versus the South, where you see more or less mental health challenges?
I don't know such data. I don't think there is a difference. There is a difference according to socioeconomic status. Okay. Lower socioeconomic status predicts more mental disorders.
Interesting. So I know there's also a huge deficit of therapists, psychologists, psychiatrists. We touched on it a little bit at the beginning. And recently, Hadassah actually opened a Ganzel Rehabilitation Center, which is the largest facility of its kind here in Jerusalem. It has both the physical and the mental health facilities. Could this help with that deficit in any capacity?
Well, at the beginning, the deficit was only bigger because we had more people that were injured and should be treated at the rehabilitation hospital. Um, but we've put major effort in recruiting more psychologists. Within 2 months, recruited 4 more psychologists only to the rehabilitation hospital, which is, I think, a national record. And it is related to the fact that we do provide the best rehabilitation services in the area, and psychologists, even arriving from the clinical practice, from the private practice, wanted to provide psychological help in the public services with rehabilitation of soldiers arriving from the war. So that was a major source of recruitment.
You're getting from all over the country people interested in working there.
Yes.
Amazing. What about from abroad, out of curiosity? I know there's been some programs that have been implemented recently to allow more people to certify quicker when they come over. Is that going to apply as well to the psychiatric facilities, for example?
It is more difficult because of language differences, because you can't provide physical help very professionally without knowing the native language. But psychological therapy, which is based on language and feeling very safe and comfortable within the conversation, it is much more difficult to do when it is not your mother tongue. But we do receive requests from Jewish professionals around the world that speak slight Hebrew or better Hebrew, depends, that do want to arrive. We actually have a nurse psychologist that is arriving, I think, next month for a year of working here at the rehabilitation, coming from the United States. So we do receive the help that we want. We ask for these people even for supervision if they cannot provide therapy, because supervision we can receive in English, and this is much help.
Fascinating. So, lastly, is there anything else that I should have asked you, or do you feel that people should know that we didn't talk about?
I think we should be aware that every person we see suffered some kind of trauma and be sensitive for that, knowing that we don't know what kind of trigger would elicit a symptomatic response. I sat with few physicians here at a panel. We were discussing the experiences of war, and some of them came back from Gaza. They were serving them there as a reserve physicians. And then the microphone was not working and it made noise. And then I was like, and they were all frozen. We sat there at a line. So I felt everyone frozen next to me because it sounded to them like gun shooting. The tuck, 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 tuck. Oh, wow. Of the microphone. People at the audience were just, they were annoyed by the noise, but they were back in Gaza. And we just don't know what kind of trigger we are encountering that would elicit stress responses. So just being more sensitive to that.
Well, thank you so much, Dr. Ben-David, for sharing this with us today.
Thank you for inviting me.